So, how common is falsification, fabrication, and plagiarism? I see when you're looking to see what's coming next all the time. So, if you had to estimate how common do you think fabrication, falsification, and plagiarism is in my university, London School of Hygiene and Tropical Medicine? How common is it? Give me a percentage. What would you say? Anybody?
More than you think.
More than you think. Would you like to put a number on that?
So difficult.
So difficult. Anybody want to make a guess?
1%.
1%. Yeah? 5%? Anybody else?
10%.
10%. Wow, it's like an auction. Any advance on 10%? We got 10% here. We got 20% at the back. Sold to the man at the back. No, we got 1, 5, 10. Fabrication, falsification, and plagiarism. Well, the true answer is we don't really know. We don't know how common. I asked we've got a very small research integrity office at the London School of Hygiene. I asked them what the prevalence of research misconduct is, and they couldn't tell me because they say we haven't found any. But there have been surveys, and there have been lots of surveys, and I think this study is by Danielle Fanelli, is a systematic review of studies of the prevalence of plagiarism, of the prevalence of misconduct. And what they do is they investigate it in two ways. They say, it's like a confidential study, and they say they assure the respondent that the results will be confidential, and then they ask them some questions. Have you ever engaged in research misconduct? Hands up who's engaged in research misconduct here. See, it's a hard thing to own up to, isn't it? It's nobody really wants to, but in some surveys, if it's done very well. I remember I was interviewed on in relation to the AIDS epidemic and things like this. I was randomly digitally dialed when I was living in New Zealand. I was random digit dialing for a telephone survey of sexual behavior. And I had all my family all around me, and I was on the phone, and they were asking me, all these questions about my sexual practices, and I was a bit surprised, but they were very clever because I didn't have to say anything. They just said, which one of these best describes, you mainly have sex with women, you mainly have sex with men, you have sex with both, you have sex with, also, and you just have to say 1, 2, 3, you just have to give a number. So it's very good. I was very impressed with this. But they used a similar kind of approach, in this sort of study, where you don't have to get anybody to say something, you just have to get them to, and you assure them it's all going to be confidential. So there are two main questions. Have you committed research misconduct? Or are you aware of anybody else that's committed research misconduct? So the evidence from this meta-analysis is that when they ask researchers, have you committed research misconduct, about 2% admit to have conducted fabrication, falsification, or plagiarism. Now, about 2%. Now, do you think 2% is an overestimate or an underestimate? It's an underestimate, isn't it? So I'm like you, Sayaka. I think, well, 2%, come on, it's more likely to be 4%, maybe 5%. So I imagine that the prevalence of research misconduct is about 5%. And so even though my Research Integrity Office can't tell me, I believe that 5% of the research in my university is fabricated, falsified, or plagiarized. Because why should it be any different? Why should it be any different just because it's my university? You know, this is a systematic review of studies conducted at universities. If anything, it's a little bit higher because some of the studies on research integrity find out that research misconduct is slightly higher in epidemiology. Epidemiological research is slightly more prone to research misconduct. Perhaps it's because it's so easy. Yeah? So it's probably about 5%. And when in this survey, when they asked, do you know anybody else that's done research misconduct, the figure's about 14%. Do you know anybody? Anyway, we don't need to ask you that question. But the prevalence is much higher, about 14%. Isn't that interesting? So what's the prevalence of research misconduct at the London School of Hygiene? 5%. What's the prevalence of research misconduct in Kyoto University? Maybe it's a special place. Maybe it's 5%. Who knows? And questionable research practices that we're going to talk about tomorrow, well, those are really common. Everybody does those. So when they ask, have you committed them, I think about, about 10% of people have done these questionable research practices, and 40% of people know. Who doesn't know somebody who's selectively reported results on the basis of the p-value? So, yes, research misconduct, these are the estimates. Self of a prevalence greater in medical and pharmaceutical research epidemiology. So in my university, we have London School of Hygiene has got all of these other universities around it. All of them have had research misconduct scandals. So I don't know if you remember the famous one about autism and MMR. That was, in the University College London. And then there's, all the universities around ours have. But in my university, there have been no allegations of research misconduct. They don't look for it, they don't find it. Do you think they would want to find it? They don't want to find it, do they? That's why they don't look for it. And that's why research misconduct is like talking about sex or death for a university, right? It's the thing you can't talk about. So we don't talk about it, we don't teach it. It's a quiet little secret that we've got. Yeah? That's not right, I don't think. So I think FFP, these serious forms of misconduct, not particularly rare, and we're going to come on to the other ones, these other questions later on. And it's really important, you see, because my experience of making these systematic reviews and publish them in the Cochrane Library, where I thought they would, be the best evidence to inform patient management, I concluded that mannitol was effective and that colloids were safe. And both of those are wrong. Mannitol, there's no evidence that it's effective, and colloids seem to do more harm than good, so it puts patients at risk. It wastes resources, big time. Think of all of the 90 papers retracted. Think of all of the editors and all of the reviewers and all of the, all of the wasted time and effort that goes into it. It undermines trust in science. You know, when these big scandals come out, you know, what does the public think about us, you know? It doesn't do us any good. It damages institutions' reputations and career. It damages institutions' and careers. Cruz committed suicide, you know. He was a sick man, I believe. That misconduct should have been found sooner, and he needed help. Yeah? You know, you sometimes in life people lose their way, you know. Maybe, I don't know, you get a mental depression, anxiety, drugs, alcohol, whatever it is. You get lost. Well, if you're getting lost, you want someone to find you and then put you back on track before you get to jisatsu, you know. He needed help, and so not looking for research misconduct doesn't help anybody. Doesn't help the public, doesn't help the patients, doesn't help researchers, doesn't help universities. Thank you very much.